Hey guys, hanging out with my man Bones here. We're in the anatomy labs in the health science and medicine area. We are about to speak with Dr. Christian Moro a little bit more about what a student goes through and actually health simulation day that a lot of our high school students are involved with. What do you think, man? Getting sick to death of me?
How do we explain to Year 11 and 12 school students what it's like to study health? Whether you're looking to be a biomedical scientist, medical doctor, physiotherapist, occupational therapist, dietitian, exercise scientist, or more, one of the big considerations is how to understand health in regards to a patient, health and disease based around it. One of the ways we do this is through using mannequins. These robotic mannequins respire. You can hear their breathing, their tummy gurgles. They have a heart rate and blood pressure, and we can give these numbers on the computer to read what's going on. This is a great way to first experience health in a simulated hospital setting. However, the way our students do experience it isn't just with the robotic mannequins. With a real patient, there's different cues and understandings. It's also talking to a real person about their health. How do we give that experience to Year 11 and 12s? Well, we use what's in the other room. The mannequins are fantastic, but in order to give our students the experience of what it's like managing a real patient, we have expert actors that can come in and present with different diseases. Today we have Rosemary. Do you mind if I come in?
We're in here.
Today we have Rosemary. Rosemary has a progressing dementia and she's come into hospital after having a fall. Our students need to consider her very complicated health needs in regards to this and work out in conjunction with her allied healthcare team whether or not we feel she's ready to go home, and then discussing with Rosemary the options. This gives our students a chance to really meet with a patient, determine the best case scenarios for them, and work with an allied health team as well as with Rosemary to try and give some good guidance and directions into the future strategies for her healthcare journey. Healthcare isn't just about hospitals, and in order to give our students an experience of what it's like working in community healthcare, we have our actor working as Giovanni. Giovanni has presented with cancer and is undergoing chemotherapy, but is looking for advice from the allied healthcare teams as to the best strategies to continue working, manage energy, maintain a good diet. What can he do to help himself stay in his career? And this is where our students can shine, giving community advice to a person who's just simply looking for help.